Hi there, this is Dr. Valli from Synergy Behavior Solutions, and we're here today for a dose of behavior with Dr. Valli. I'm being joined by Sara McClowdery, who's our training and behavior modification coordinator in the beautiful outdoors. I'm feeling very jealous.
Yeah, it's a great day here in Portland, Oregon. So I had to go and jump out on my deck for a little bit. I couldn't not sit outside for a little bit.
I know, I'm looking at the sun coming in through my window and wishing. So cool. Yeah, so we're going to talk today about some of the mythology around treats, using treats and using food for training.
Yeah. So I know the biggest myth that we get, I think when clients come in and maybe they haven't used food as rewards for their pets, and both cats, dogs, and birds, and all of our pets, is they're usually really afraid that their pet is going to get fat. And so I think that's the first thing from the veterinary side of it, Dr. Valli can talk about, and I can talk about from the trainer side of things.
Right. Yeah, that's a pretty common question that we get, and I get that question from clients when they're coming to us for their dogs, and we also get that question from veterinarians as well. We have, at least, what's the statistic now? Like 25% of pets are considered overweight, if not more, or considered obese, if not more. So we have a lot of, so obesity on the veterinary medicine side is really important to consider because being overweight can predispose dogs and cats and birds to other medical conditions. So, when we're thinking about working with treats, we want to also consider that we're not wanting to start a medical condition trying to help a behavioral condition. So, but it is a really common question that we get asked is, well, if we're going to use treats, isn't the patient now going to get really, really fat? And the short answer is no. If you've seen any agility, if you've seen a lot of the sporting dogs, a lot of these dogs are taught primarily with treats. And obviously these dogs are very fit. So you can absolutely train with treats. And all of our clients are trained with treats, or I'd say 99.9%. We do have some who also use some toys as well, but it's really rare that we would have a dog who is not using treats whatsoever. And I would say by and large, our population of dogs is not just suddenly getting obese of the dogs that we work with. We do give strategies to clients about how to minimize the chances of their pets becoming overweight in the first place. And we can talk about that a little bit later too, if you want.
I know personally with my own dogs, I do a lot of training, and I actually use their own kibble in training a lot of times. There are situations though where using their own dog food is not appropriate for training. If it's a high stress environment, things like that. My dogs are all taught when they first come into my house, either as puppies or as a newly rescued dog. I work all of their meal times as training. So they start to learn how to work for their meal in a training scenario. It is a skill that they need to be taught. And so we'll do that. And then what I find is that my dogs will take their dog food as training treats in a wide variety of settings, because that's very much what they're used to. Back before I would do that with dogs, a previous dog, if I would try to use her dog food as training, she would then go back to where she would go get fed normally and ask for dinner again. In her mind, if she did not get some food in her bowl, she did not have a meal. And so we always used to joke that we would give her the ceremonial meal, where we'd put like 5 kibbles in her bowl and give her bowl, and she would eat out of them. And in her mind that she had gotten her meal. And then I could use her food for training in other scenarios. So
yeah, and for my personal dogs, I would train with kibble also. I would also train. So all of my dogs were when they were younger, and we did a lot of sporting things. So we did nose work, and we did agility and obedience, and so we used a lot of treats with them as well. One of the big things that we did to make sure that they were minimized in any sort of weight gain was to cut up their treats really, really tiny, so that, one piece of, like, one little ring of mozzarella stick slice would be 10 pieces of treat for them. So the more that we could take that and have it be just like a little quick swallow of something really yummy, the better. Then they would not only not get full, but they would also be anticipating that, but they also wouldn't put on weight. So with all these sports that we're talking about, we really benefits them for being lean. One of our dogs also was a dog who had multiple orthopedic issues. So in order for her to stay as mobile as possible, she was kept really lean as well. And we did a lot of training with her with treats. So you can absolutely have dogs stay lean with that. A couple other strategies to think about might be to actually, if you're going to be using a lot of treats, think about maybe do we give them a little bit less of their kibble. We don't want to give them, we want to try to keep their meals somewhat balanced. So we don't want to give them like all cheese and no balanced food. But if you're doing a lot of training one day, then maybe back off a little bit. So some other things, and Sara, jump in on this too, but there are those food rolls that are really tasty that you can cut up into a balanced meal as well. You can use like really low fat meats. So that could work really well.
Yeah, little pieces of chicken go a long way for high value, but not, and then you also, it's not as much, I feel it's not such a big deal to cut out a little bit of their meal if you are giving them a whole meat and things that are, pretty healthy for them in general. I love using some of the air dried or freeze dried dog foods that are a regular dog food. So Ziwi Peak makes a great it's technically a food, but it breaks up into small pieces. They have a couple different varieties that are really smelly and yummy. So that's another great one if you want to cut back. I have a really small dog with Bueller, and so I have to be really careful because he fills up quickly. So, a 16-pound dog is a little bit different than your, Labrador. And so I have to be very careful about his amount of food versus his meals for him.
Yeah, and actually thinking about your dogs, and my dog needs me to think about also special diets. So one of the other questions that we sometimes get is, okay, well, my dog has this very specific diet that they're on. So how am I going to train with food because maybe they don't like this diet or what have you? And so some ways around that, some dogs it's really, really strict. And so if it's really strict and they have to eat this kibble and nothing else, then doing some of the things that Sara talked about as far as teaching them to eat the kibble in different places can be very helpful. Several of the prescription dog foods have a canned version. So you can use the canned version for higher value treats, and you can use a squeeze tube. There's various squeeze tubes out there that you can get. Even those human gear shampoo tubes is actually one of the things that we use at our facility. That you can squeeze from and deliver the wet food without having to get your fingers all dirty. If you have a dog who has a particular meat that they can eat, then so for example, if they can eat venison and potatoes or something like that, then maybe see, can you get venison from someplace and use those for treats? There are some brands of either foods or treats that are specifically various protein based. So that could be another option too.
Yeah, because my dog Rizzo, is what Dr. Valli is referring to. She has a lot of different food allergies. She is able to eat pork and salmon and whitefish and rabbit. And luckily, a lot of those I can find single protein source food treats for her. But a lot of times I buy bacon, and she gets a little bit of bacon. I also buy pork tenderloin, and I cook it up and cut it up, and then I'll do a big batch of it and freeze sections of it so that it'll stay. So when I need it, it's ready for me. When Dr. Valli was talking about the food rolls too, that's what I do for my other dogs with the food rolls, is I'll cut the whole roll up and then put it in little snack size bags in my freezer. And especially as we're coming into summer, just pull it out of the freezer, put it in your training bag if you're going for a walk. And as you walk, it will defrost and your dogs are getting a great treat. And it's a little, cooling factor too, can be helpful.
There are also some specific treats that are out there. There's a veterinary dermatologist locally who makes her own treats. It's called Syringy. we can put the link in our the comments afterwards. But she has some like oatmeal, I think it's oatmeal molasses cookies that a lot of our sensitive stomach dogs seem to really like and seem to work really well for them. So there's some other there's a range of options. So if you have a dog with food allergies, it doesn't rule out having it doesn't rule out being able to use food.
The other trick that I have for some of our food allergy dogs is you can take a chunk of something stinky and yummy, like a chunk of blue cheese or a chunk of hot dog, and you put it in a tea ball that you would steep tea in, and then you can put it in a plastic bag with their food and put it in the refrigerator. And being in the refrigerator, the kibble will become a little bit softer, so it's easier to break up to make smaller treats, and it will get the ode to blue cheese without getting the actual blue cheese, because you did put it in that metal tea ball inside the bag. So they're not getting any of the actual blue cheese, just the stink of it. And a lot of times that can raise the value of the kibble. And definitely some of those prescription diets, the kibble pieces are pretty big. So being able to have it softened and break it up is a lot easier too.
I'm just thinking, I just hate the smell of blue cheese. So I'm just thinking I would.
But you're not a dog.
I'm just thinking if I ever have to do that for my dog, but goodness knows I've been feeding all sorts of things to my dogs recently. So I have my dog with, Sara knows I have a dog with IBD. So getting him to eat sometimes is a little bit of an adventure, but he's doing well now.
I feel both of us have fed fish flavored kibble over the years, and just that alone is pretty stinky. So I always think the stinkier the better for dogs when it comes to training treats, for sure.
Yeah, absolutely. One of the things also, one of the benefits of using food for training is that oftentimes is a really good barometer for us to be able to tell where an animal is at with respect to its comfort level. So if we have a pet who maybe is refusing to eat, and generally it's a treat that they would really like, then it gives us information about, well, maybe this is not a situation that this pet feels really comfortable in right now. Yeah. Maybe we need to change something. So when I go to veterinary hospitals to do presentations on fear-free or reducing stress in the veterinary clinics, one of the most common questions I get is, okay, well, you have this pet here and they're refusing to eat treats, so then what do you do? And certainly one thing that you can do is you can try other types of reinforcements, like play or petting for some pets can be helpful. But I'd say that one of the things we have to think about is, okay, well, what can we change? Is there something that we can change to make it so that that pet is feeling more comfortable so that they can eat? And is it something they like? That's the other thing.
Yes, Cheerios are not a high value treat. And usually carrots are not either. I always joke that when people are like, oh, it was recommended me to feed Cheerios. I'm like, the second ingredient is sugar. How much do you really want your dog to be eating that? But that's just me. I know we get a lot of questions too, Dr. Valli, about eating when going into the vet hospital prior to any type of procedure happening, where normally you have to have your dog fasted.
Right.
That's another big one.
Yeah, that's a big one that's coming, and certainly there's a lot of discussion and talk around that. For a lot of dogs, something that we can do is because the big thing with that is that when you have a patient who's about to be anesthetized, all their muscles become really relaxed, and so if they vomit, their throat doesn't work the way that they usually do. So what can happen is what they vomit up can go into their lungs and cause them to aspirate, and you can develop pneumonia that way. So we have to be really careful that we don't have anything in the stomach for the dog to vomit up. What you can do though, is that a lot of places are doing like just a really, really thin smear of something like squeezed cheese on like real thin smear on a plate, or maybe frozen broth in a little Dixie cup that they can look at while they're doing various procedures with them prior to that. So for example, if they're putting a catheter in, or if they're giving a sedation injection, so that the pet can have something positive prior to actually having the anesthetic done, which is going to minimally put something into their intestinal tract and reduce the chances of any sort of aspiration, but still allow them to have a positive experience.
Yeah, one time when one of my dogs had to go in, we used baby food in the little squeezy tubes. So it was very liquidy. It was a strawberry flavored applesauce because she loves strawberries. And so it was liquidy enough that they felt it was a good compromise where she could get some positive reinforcement, but not be worried about the aspiration issue.
Mm-hmm. Yeah. So I know that we're kind of running towards the end. Is there anything else that you want to make sure that we talk about today?
I don't think so. It doesn't look like we have any new questions. If you are watching this later and you have questions, please feel free to drop them in the questions section. We do know that this is one of those kind of slightly taboo topics sometimes, so people are afraid to ask, but please feel free to either leave a comment with the question or feel free to give us a direct message. And we hope you have a great day. Hopefully it's as good a weather wherever you're at watching us. And I'm Sara McLeodry from Synergy Behavior Solutions.
I'm Valli Parthasarathy.
And we look forward to seeing you next Wednesday for a dose of behavior at 2 o'clock Pacific time.
Have a good day, everyone.
Bye.